Yes, wonderful people. Our day. Once again, we dey say good morning from we yard here. Yes, on Health Matta. Like we take talk some few minutes ago, say we go dey report to this arena where we go dey discuss it. Basically, as it be Saturday. My name is never change. I still Chief Olododo alongside my teammates Slimity and Dr.
Chief.
Bat.
Yeah, good morning.
Slimmers.
I hope you're not feeling cold.
I am cold, but I think it's just the time, is the moment, is the weather. So.
Yes, you can manage.
Yeah, I'll manage.
Yeah, Chifo.
Good morning.
So pleased to be back with you this morning. Yeah, good morning, viewers at home and around the world. My name is Dr. Bartholomew Tochukwu Febunam. I'm the Medical Director of Grace Valley Medical Center here in Lagos. Today, we'll be looking at a topic we started last week. Benign breast conditions or non-cancerous breast conditions. Now, what is it all about? Okay, as we always do, we'll make a definition. Breast is something that we're all used to. We all know what it is, okay? But we're going to talk about the medical aspect that a good number of us may not know about them, okay? We're going to talk about self-breast examination that every woman is expected to do on monthly basis. Okay, once you hit the age of 20, we're going to talk about some of these conditions. Are they risk factors? We'll know. How are the diagnosis made? Can they transform to cancer along the line? All of these and many more are what we'll be looking up to in the program. So what is breast? Now, every human being has two breasts, usually on the anterior chest wall, okay, or pectoral, or covering the pectoral aspect of our chest or pectoral muscles. Now, the breast in the female is a specialized tissue, okay, with a primary function of providing nutrition for the infant or for the babies. Beyond all of that, we all know that breast has a lot of other significances, but this morning we'll be looking at the medical aspect, okay? So now, to enable us understand what we're going to talk about on breast today, we'll take a brief look at the anatomy of the breast, okay? Because most of the diseases that we're going to talk about will have their names originating from a particular section of the breast, okay? Now, we all know that when when children are born, for both male and female, the breasts look alike, okay? But as they grow along during puberty, there are a number of changes that are brought about by some important hormones in the body of the female, talking about the estrogens and the progesterone. So with this, there is a fuller development of the breast in the female, in the sense that the mammary glands and some of other functions that it observes now become much more pronounced than it was at the early age. Now, essentially, a fully developed breast will have about 20 sections, 15 to 20 sections that are usually referred to as lobes. Now, within these lobes, which are interconnected to each other, are a dense fibrous connective tissue that usually separate them one from another. And within these lobes are smaller sections that are usually called lobules. These lobules is the milk-producing aspect of the breast. Now, these lobules are usually interconnected to each other by a set of tubes that are called ducts. Now, these ducts, just imagine what you have when you have the spokes that are radiating from the inner part of a wheel of a bicycle. That's the arrangement that you have, spreading outwards, like the picture we are seeing on our screen at the moment. Okay, so it gets connected, and of course, the ducts will join themselves to form larger ducts that eventually will end in and around the nipple and open up with about 20 to 15 openings at the substance of the nipple. Essentially, the breast has the nipple, and immediately around the nipple, you have a pinkish to brownish pigmented area, depending on whether one is fair or dark in complexion. Okay, that ring of area is referred to as areola, and of course, it has a lot of functions which we are going to talk about along the line. Now, The inner part of the breast are made up of, apart from the lobules that we've talked about and the ducts, there are also fat tissues that are scattered all over the place that are largely responsible for the shape of the female breast. Beyond the fat tissues are also other structures in the breast that we'll need to mention, talking about the connective tissue, the fibrous connective tissue that give the breast its support, okay, its firm support to the chest. Also, just like every other organ of the body, the breast has its own fair share of blood supply that comes from the heart. Of course, we treated the heart some few weeks ago. Okay, now how does the breast get its blood supply? Majorly through a number of arteries. Okay, when we mention vessels, we are talking about arteries and veins. Okay, so through a number of arteries. Okay, for people who are medically inclined, I want to mention some of the names of the arteries that supply the breast. Okay, so you have the lateral thoracic artery, as well as the internal thoracic artery, as well as the thoracoacromial arteries, as well as the thoracoacromial arteries. Okay, now these arteries are responsible for taking blood to the breast. Also, this blood will need to be drained out of the breast, and of course, the number of veins that will do this work. Top on the list is axillary veins. Okay, that does the work of returning the blood, okay, to the heart. The breast also has innervation, talking about nerve supply, that are responsible for the sensation that we usually feel when we are when our breasts are stimulated. Okay, now this set of nerves permeates every part of the nipples. Okay, also within the nipples are myoepithelial tissues, or small muscle fibers that are usually responsible for the extension or elongation that can happen in the nipples, especially when a baby is trying to suckle, and some other instances as well. Beyond all of this, I would like to talk about the lymphatics that permeate the breast. Okay, just like every organ of the body, the lymphs actually drain, it cleanses the organ. Okay, so the breast has a set of lymphatics too that drain the breast. And also, when there are issues with when there are a pathology, or when there is a pathology with the breast, like breast cancer, it gets to transfer from the breast. It gets to move from the breast to some other parts of distant aspect of the body through this set of lymph nodes, through this set of lymphatics. So you have you have lymph nodes around, in and around the breast, as well as the armpit. That's the axilla. That's the medical name for it. So oftentimes when you're doing self-breast examination, you're expected to check your armpit on either side for the presence of lymph nodes. Now, these lymph nodes ordinarily should not be swollen. So when you check your armpit, you're not likely to touch them. When there's in a situation where you have an ongoing pathology, the lymph nodes will become unduly swollen. And of course, because of the inflammation that maybe we have some pictures showing on our screen at the moment. Now, you can see those scattered, dotted, greenish colored knob-like substances all over the places that the lymph nodes. You can see they extend all the way down into the axilla. When you're doing self-breast examination, those are part of the things that you need to check out for, whether you have them, whether you have multiple lymph node swellings within your armpit. If you do, it's a sign that you need to see your doctor. Now, this takes us to self-breast examination. Okay, so we need to dwell on this topic, because last week we weren't able to do so in full. Now, what is it all about? We all know that the key to surviving breast cancer is early detection. I said last week that over 3 million people in the US have been able to survive cancer. And why was it possible? Because it was detected early enough. Now, the only way you can actually help to detect is to get used to what it is. You need to get accustomed to what the normal looks like. If you're a female, if you've attained the age of 20 and beyond, okay? Now, we advise that usually this self-breast examination should be done on a monthly basis. You need to pick out a particular date a particular time of the month.
Anytime or before or after
Yes.
the period?
Most authorities actually prefer after the period, because usually after the period, shortly before the period, yes, the breast gets bigger than usual. But a few days after the period, of course, the tenderness, the soreness would have gone away. So you have a clearer, it will be much more stable to be able to do the breast examination. So you may decide to choose maybe the 5th or the 4th day after your menses, okay, and you have it marked on a calendar so that always when it gets to that particular time of the month, you need to do it. Now, beyond, if you've attained the age of, if you've gotten into menopause and you no longer see your monthly period, you also will need to mark your date. You may decide to choose the first day of the month or the last day of the month. That is for senior citizens who may have gone into menopause. Okay, now you keep doing this until you probably reach the age of 74. Usually we also say when one gets to the age of 40, there are other imaging investigations, 40, 45, that could be employed, okay, on yearly or sometimes on two yearly basis. Okay, so this is what you keep doing until you hit the age of 74 to enable you pick out a problem when one exists early enough, so that, of course, good intervention can be placed on a good time, and of course the person can survive. Now, what are the methodology of self-breast examination? We want to go into all of that this morning. Number one is that sometimes it's advisable you stand before a mirror. Now, when you stand before a mirror, you may choose to do it when you're having your bath, because some people believe that the body is a little bit more slippery at that time, and then your sensation may be a lot more increased. Now, you're expected to examine yourself with the pop of your fingers, of your 2, 3, 4 fingers. And now you do it in a systematic way. Now, the essence of doing that is to ensure that every quadrant of the breast is properly examined. I'm talking about the one that you need to do yourself if you are a female. Okay, usually we advise that you should imagine having a line dividing your breast into 4 equal parts. Okay, so in that order, you have the upper outer quadrant, which usually is the area that most breast lumps usually will appear in. And of course, oftentimes extending into the armpit or into the axilla. Now, the way to go about it is that before a mirror, you should raise up your hand. First, you need to observe. Take a good look. What are you looking out for? Number one, you want to know, are there skin color changes? Are they dimpling? Okay? Are there some form of puckering? Are there retraction? Does it look as if one of the nipples is being pulled inwards? Okay? These are some of the things that you need to look out for. Are there discharges that sometimes could stain your nightgown? Okay? Now, you also need to give a gentle compression of your nipples to see if there are discharge. Now, you also need to analyze what sort of discharge is this. Is it milky? Is it clear colored? Is it bloody? Okay? You need to know. Now, to examine the breast, once you have your hands elevated, first you do is to observe. Okay? See if the two breasts are at the same level.
But if we believe that the breasts are never the same.
I agree with you. Okay. So you may have one bigger. In some people, one may be bigger, but in some others, are the shape exactly the same. Even if they are not exactly the same, of course,
you see notice.
Yes, if you have an abnormality, you actually will pick it out. Okay, that is if you're already accustomed to doing this. In a situation where you don't do, if you have an abnormality, of course you won't pick it. You won't pick it out. Now, apart from examining in those 4 quadrants, okay. Now, to do the examination proper, you keep your arms around your waist. That helps to relax your muscles, your chest muscles as well, so that you can have a better view. And then with your right hand, you examine your left breast. And of course, with your left hand, you examine your right breast. Okay, so it's not like this.
Let's hold you there a bit, Dr. Bat, so that we can go on this short break. Health Matter. We'll be right back. Go nowhere.
Health Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Okay, welcome back to Health Matter and the clinical analysis of what the breast looks like and the other component of the breast. Now, Dr. Bati don't they do since before we go on that break. And whenever I read this segment, I hear we dey take open phone line so that when ourselves go fit chook mouth. Like we dey talk now, participatory show. Yes, let us do it together. You can participate by calling into the show and ask your question or your contributions. Slimy?
Yes, okay. So please feel free to ask any questions where they bug you, anything we want to know about what in doctor they talk about this morning. 08105434985 call 08173147589. Just kill the volume on your TV set and of course do the needful. Thank you.
Yeah, thank you very much. So we left it out at self-breast examination, and we say usually you're expected to make sure that you examine the 4 quadrants of your breast. Now, a number of ways that you could have this achieved, or you can do this. Number 1, you may decide to go in a circular pattern. Examine the inner circle and then increase outwards, circular by circular pattern, until you're sure that you have examined all the substance of the breast. And of course, you need to extend your hand into the armpit, into the axilla, okay? Because of the axillary tail that usually extends into the axilla, okay, or armpit, okay? The medical name is axilla. Now, another way of doing it is to go in, like if one is cutting a, as if one is going in a zigzag manner. Okay, so you go one stretch at a time. You start from here and then you move up and down, up and down, up and down, up and down, just like a lawn mower. Okay, and then to ensure that from one end of the breast, you're able to take it and feel deeply in and out until you get to the other end of the breast. Okay, those are the 3 methods you can use. Examine each quadrant, examine on this side, with this hand, examine the opposite side, so as to make comparison of whatever you may be getting. Okay, now permit me to also point out that when you touch the breast of a female, you will feel some things in there. And of course, those are the things that we've talked about, that you have 15 to 20 sections of lobes, okay, that are subdivided into smaller components that are called lobus, which are of course the milk producing aspect of the breast. And again, these are interconnected to a group of ducts. We have talked about that before. So you have diseases of the breast that affects the lobus, okay? You also have the diseases of the breast that affects the ducts. So almost all the diseases that we're going to talk about will be either the disease that affects the lobus, or the ducts, or the fat tissues of the breast. Okay. Now, what are some of the conditions that can affect the breast? So permit me to also point out that 80 to 90% of all breast lumps are usually benign, are usually non-cancerous. Okay. Only about 15 to 10%, okay, may become cancerous at the end of the day. But you're not going to stop there, because some of the ones that are benign can undergo malignant transformation. The ones that initially appear to be benign may eventually become cancerous at the end of the day. We'll see some of the breast conditions that can actually transform to malignancy along the line. So it goes to, what that means is that any lump at all you feel on your breast must be a source of concern. Now, I will start with fibrocystic breast changes. Any woman in her reproductive age will have some changes that are going on the breast, on both breasts, usually on cyclic or monthly basis, related to the changes that occur as a result of the hormonal changes too, okay, that happens on monthly basis. Now, fibrocystic disease of the breast, okay, are changes that are usually bilateral. You have them occurring in the breast, in both breasts at the same time. Sometimes it could be painful. Okay, you could feel your breast may feel lumpy some few days before your menses, before your period, and afterwards, by the time you're done with your period, you may discover that those lumps are no longer there. Okay, so those are fibrocystic breast changes. Then, as the name sounds, okay, fibrosis, cystic. Now, fibrosis has to do with the connective tissue component. The cystic has to do with cyst. We've spoken about that countless number of times. What are cysts? Fluid-filled sacs. Oftentimes, some of them may persist beyond the monthly cycles. Okay, do they require treatment? No. Now, this fibrocystic breast disease usually occur between the ages of 30 to 50. Usually at the time where you have, because they are believed to have a strong estrogen response. Okay, so usually in a woman's reproductive age bracket. Okay, so if you have such changes, it may not require treatment, but of course you need to find out what they are because they come and go. Now, next to that is what we refer to as hyperplasia. Now, hyperplasia, we talk about usual hyperplasia and atypical hyperplasia. Now, the hyperplasia can affect the lobus. You call them lobular hyperplasia. Hyperplasia, if it affects the ducts, call them ductal hyperplasia. And of course, the hyperplasia simply means an overgrowth of the breast tissue, okay? An overgrowth or proliferation, excessive proliferation of the breast tissue. Usually it is picked from breast biopsies. When you do a biopsy, you will find out that you have, in usual hyperplasia, you have a normal breast tissue multiplying abnormally. Okay? Now, the chances of transforming to breast cancer at the end of the day is slim. Unlike atypical hyperplasia, where you have an abnormal breast tissue multiplying abnormally, the chances of transforming to breast tissue is higher. We have Johnson from Kwara.
Hello,
good morning, Mr. Johnson.
Good morning, Slimmy and Olododo, and the doctor over there.
Yeah, thank you very much.
And doctor, I just want to ask a question.
Please go ahead.
I don't know, you're talking of breast cancer, but when, talking my, but I don't know the word to use. But when I'm doing what my baby should be doing with my wife, in the breast side, does it help?
Does it help?
Oh, thank you very much. Does it help to prevent breast cancer? Is that what you mean, sir?
Does that help?
A lot of studies have actually, but none is proven yet that it helps in anything. Okay, so it's neither here nor there. It's neither here nor there.
Well,
thank you.
What would you advise somebody that has had a breast surgery before? Like maybe she had lumps, because I have a case like that. She had lumps in her breast. She got operated on, and then the lumps returned. Is it advisable that she just gets rid of the breast to avoid breast cancer?
No. You can't do that. Now, thank you very much for that wonderful question. I have seen, it's possible. I have seen young females that were operated on account of breast lump before, okay? And then a few years after, they come down with another set of lumps. That can happen, but it's not an indication to actually have the breast removed for any reason. No, the only reason why you go for removal of one's breast, if it is proven that the person has breast cancer. Of course, when we go into breast cancer, by next week, properly, we'll be able to say a lot along that line. Okay, so, but that's not an indication to take out anybody's breast. Okay, so the atypical hyperplasia, like I said, can affect the duct, okay, and it can affect the lobus. Depending on part of the breast that it affects, of course, it will derive the name from there. And of course, chances of transforming to cancer is equally high. Now, the next one I want to talk about is fat necrosis. Breast fat necrosis. What is it all about? Now, sometimes it has to do with a trauma to the breast, to any of the breast. As the name implies, fat necrosis. The affectation is not just on the glandular or the lobular part of or the ductal part of the breast, but the fat tissues. How sometimes a number of things have been implicated to cause this in the females, one of which is the use of seat belt in the car. Yes. Okay. So inadvertently, you could injure your breast. You could get your breast injured by having the seat belt strapping on your breast and driving to work on daily basis. Okay. Now, when that happens, you could develop a lump. What happens is that the lump develops out of the fibrosis that happened as a result of the injury. It has to affect, that happens as a result of the frequent injury to the breast. And it will look as a lump, and it will become like a lump. And sometimes it could be painful. Okay, when you go for imaging, breast imaging investigation, that can be picked on by, depending on one's age. If you're above the age of 40, of course, you can go for a mammogram. But if you're below the age of 40, in which case you may not be able to go for mammogram, you may make do with some other breast imaging investigations, like breast ultrasound, that can easily pick it up. Okay. Also, breast MRI, magnetic resonance image, can equally pick it up. So, fat necrosis can be a cause of painful breast lump, which could be caused by trauma and injury to the breast. And you may not be in the know when it exactly happened. Now, next to that is mastitis. We talked a little bit about that last week. What is it all about? Usually found early with in mothers who are nursing babies. Okay. Now, it occurs. It usually has to do with a swollen, reddened, and painful breast. Usually it happens with one breast. Okay. Now, in the course of breastfeeding, bacterial infection may get into the substance of the breast through a broken nipple, and of course cause infection. The most implicated organism is Staph aureus. Okay. Now, when that happens, the breast will become massively swollen, inflamed, and sometimes it could present with fever. The mother will have very high fever. Okay, we see that from time to time. Now, when it happens, the person will need to get to the hospital. Okay, because the only link that could make anybody think it could be mastitis is the fact that such a person may be breastfeeding at that particular time. Otherwise, it could mean some other things. Some other breast condition can actually mimic mastitis. We'll see more of that when we get into breast cancer proper. Now, what do you need to do? Okay, get to the hospital on your own. You can take a number of painkillers. You can do a warm compress at home before you get to the hospital. Now, when you get to the hospital, the doctor will examine you. One or two investigations may need to carry out one or two investigations. Full blood count, it may show elevated WBC count, which is, of course, is a sign of ongoing bacteremia or sepsis or bacterial infection. You could be put on antibiotics, adequate analgesia, that's painkillers, and of course, mothers are also advised to still keep breastfeeding with that breast because it will help to ease out the pains, the tenderness, and the swelling, as well as help to push out the bacteria. It's not going to affect the child adversely. I know some people may want to ask questions along that line. Now, next to this is what we call mammary duct ectasia. Mammary duct ectasia. Now, again, it has to do with the duct. Okay, it's an inflammation that has to do with the duct, oftentimes causing a blockage of the duct. Ducts are the openings that carry milk from where it is produced to the nipples, to the substance of the nipples. Okay, don't forget, when we're talking about the components of the breast, I talked about the areola. Okay, now immediately after the nipples, where you have the pinkish to brownish pigmented area, okay, that is called the areola. It contains some specialized glands. Some of them sebaceous glands, some glands of Montgomery. Okay, they have some functions that they perform in the body of the woman. A woman who is breastfeeding, such sebaceous glands, for instance, will help to lubricate the breast. Okay, from the inside. We'll have Lawal from Borno.
Good morning, Lawal.
Good morning, sir.
Good morning.
How are you doing?
I'm fine, sir.
Okay, go ahead with your question, please.
I'm calling from Borno State.
Yeah, thank you. Where is Borno today?
Yes. Well, okay.
Yeah, thank you
Okay,
very
go
much.
ahead with your question, Lawal.
Yes. It's about, you say something about this seat belt.
Yes.
Yeah, yes.
Go ahead, sir.
Lawal, can you turn down your volume?
Okay.
Yes, please.
All right.
Thank you.
All right.
All right, so go on now.
Well, you say something about seatbelt, that putting seatbelt on a daily basis that can cause
Fat
damage to the
necrosis,
Yeah.
yes, for a female, not for a male.
You see this our road safety and the BIU.
I know where you're driving to.
Does not mean we should break the
Okay,
law.
thank you,
Actually,
Lawal.
using
But,
it for
yeah,
your
but,
safety.
yes,
Yeah, I think we
But-
should even talk more of the safety than
Yeah,
the law
yeah.
itself.
yeah, because for the same reason, I think I get the drift of his argument. Okay, pregnant women, sometimes you get a number of them telling you that it's so uncomfortable for them to use a seatbelt while driving. Ideally, I'm not sure I'm not a road safety officer, but I'm not sure a pregnant woman should be allowed to drive.
Abi?
In the
Yeah,
first instance.
that's the thing.
Okay, but talking about the fat necrosis, the important thing is that it has been implicated. Now that you know, what you can do is to adjust this in such a way that it won't grab and then be pulling down unduly on your breast. Of course, it can cause trauma. By the time you hit gallops and you jump out and in and out of the place, it can actually injure you without your knowledge. And
Doctor,
tomorrow you may be having a lump.
You'll be talking about female. So are we saying that it's not possible for men to have breast? Because me, I've seen men with breast. No, seriously now. We've seen how no, seriously, most times
You want to start a fight with Chief?
I'm not starting a fight with Chief, but I've seen like men. It wasn't transplant. And maybe because they have fat and all of that.
We are still coming to that. No, you're 100% correct. I was only trying to pull your legs. Okay,
yeah.
so male too can have non-cancerous breast condition. Okay, the most significant one is one that is referred to as gynecomastia. Okay, now gynecomastia occurs as a result of hormonal imbalance. Now, what could be responsible for this hormonal imbalance? It could be drug, it could be hormonal changes. Okay, usually you may find that happening in males that are attaining the age of puberty. Okay, you discover that their breasts are unduly enlarged. Okay. Sometimes even as big as that of a female. Okay, now what that means is that except if it gives, if it is symptomatic, no treatment may be required. Okay, we have Chris from Rivers.
See?
Good morning, Chris.
The guys are calling.
Chris, good morning, sir.
Good morning, Chief.
How Rivers this morning?
Last week it was the females.
Fine.
You need to be audible, please, so that we can hear you.
Fine. I'm okay.
Okay, go ahead with your question, Chris.
My question is, on this, sometimes we see some oversized big breasts. Is it normal or is it disease? Some of our youths these days, they tend to grow more breasts than when they are young. So my question is it normal or is it a sickness or is it a cause?
Thank you very much. Thank you very much. You got me cracking with those questions. It's none of the above, my brother. Okay, so let me answer by saying that as humans, we don't all have the same height. Okay, I'm taller than Chief, and of course, Chief is taller than Slimmy, but I'm not sure of that. Okay, that is what is obtainable when it comes to some of the organs of our bodies. Okay, we can't always have them the same. Okay, some may be bigger than the others. Just like you have our fingers. Okay, they are not all of the same size. Okay, or sizes.
It's not a threat.
Yes, if you like. So it's not a problem. Are they diseased? No, they're not diseased. So they don't start looking at anybody with, are you sure this one? No. None of that. It's just that God has beautified each and every one of us in accordance with his own wisdom. And we must appreciate what he has done for us. Okay, thank you very much for that question. And the next I want to talk about is fibroadenoma. We're talking about tumors now, benign breast tumors. Now, fibroadenoma usually occurs in females within their reproductive age group. It also has, just like we said for fibrocystic disease, it also has a strong response for estrogen, for the hormone estrogen. Okay, so what happens is that when a woman has fibroadenoma and she's pregnant, now because of the increased level of estrogen that occurs in pregnancy, fibroadenoma tends to become bigger and bigger with pregnancy. Also, if a woman has attained the age of menopause, in which case you have a decreased level of the hormone estrogen, the fibroadenomas will usually decrease in sizes. Okay, so more or less it moves with this hormone. Now, fibroadenomas are the commonest causes of breast lumps, okay, that you can have anywhere in the world. Now, the fibroadenoma too, we have Plateau from Rivers. Plateau, good morning.
Good morning, doctor.
Yeah, good
Plateau.
morning. Good to have you.
Good morning, Olododo.
How you doing?
The only man with the white hair.
You already
I
know.
believe you.
How you
Thank
doing?
you.
Sir, I love the program this morning.
Thank
you
you.
very
I
much.
want to find out how do we know that a lady has a breast cancer? Because, men are good in sucking. And it's very palatable when you are sucking and you don't even know that a lady has a cancer of the breast. So, sir, I want to find out how do we know, what are the signs and symptoms, when you see a breast puppy,
Thank you very much. No, it's not a funny question, but it's a practical one. Now, thank you very much for that question. How do you know? Usually, I've talked about the presence of lymph nodes, significant lymphadenopathy. Okay, but I also want to, I'm a man and I know what you're talking about. It's not all the times that when you want to get into such ads that you start examining anybody's armpit. I'm not sure anybody does that. Okay, especially if the woman opens up to you that she has a number of swellings on her armpit and all that. But you can know through the size. Sometimes in cancer, you could have a bloody nipple discharge. I'm not saying that anytime a woman has bloody nipple discharge, that is a sign of cancer. Intraductal papilloma, which is a benign breast disease that we're going to talk about next, is actually one of the commonest causes of bloody nipple discharge. Intraductal papilloma. Okay? These names are sounding a bit Greek, and there's no way we can break them any further down. Okay? Now, also, there could be some breast color changes. When you see that the color, there's a color change on anybody's breast. When you see that the nipples is appearing as if somebody is pulling it from behind with a rope, okay, those are danger signs that someone will need to raise. Someone needs to have a high index of suspicion. But for a man, I think the commonest you could see is that when you get into the act and you discover that you're getting some stuff that looks like blood, come on, you have to apply your brakes at that point. Okay, so that takes us to the next one. But before that, let's be done with fibroadenoma. Also, fibroadenoma are usually small, circumscribed breast lumps. The sizes usually hover from 2 to 3 to 4 cm. They are usually rubbery when you touch them in texture. When you feel them, they are usually rubbery, okay, in texture. Apart from the fibroadenoma, we also have another tumor that affects another benign tumor of the breast, which I called intraductal papilloma. Just like the name implies, it is a problem, is a pathology that affects, again, the ducts. Okay? Most of the breast pathologies appear to be affecting the ducts. Now, what happens is that there's a papillary growth or wart-like growth within the lactiferous ducts. Okay? When they occur singly, they are likely to be benign. But when you have the intraductal papillomas occurring in multiple numbers, chances of becoming malignant or transforming to malignancy, to cancer, at the end of the day is quite high. Also, we have Phyllodes tumor. Okay, is a form of benign breast condition. Sometimes it could also be malignant. Phyllodes is taken from the name. Phyllodes means leaf, leaf-like. They are usually giant tumors that are usually fast growing, rapidly growing. that are found on the breast. Usually the sizes may hover from 6 to 7 or to 8 cm. Okay. Now, when you have such lumps, such a person needs to present in the hospital because there is a need to urgently take them out so that they can be sent to for histopathology and all whatnot.
You went quite far today.
I think we went quite far, and all thanks to the doctor for taking us this far.
So by next week, we'll be talking about breast cancer proper.
Okay.
So don't go nowhere.
Okay, on that premise, we want to say thank you very much. You do have a fabulous weekend. From every one of us here, we say
Thank you.